By removing the governor's proposal to expand Medicaid in New Hampshire, we knew we were likely setting ourselves up for a special session in late fall. We didn't know we were setting it up for today. I think that most of us can agree that access to affordable health insurance is a problem for many low-income New Hampshire citizens. It's not that the people don't want to have health insurance, it's they just can't afford it. One solution, Governor Hass's preferred solution, was to add all those insured people to the existing Medicaid system. However, the Senate said no to simply expanding financially struggling entitlement program. So we led in a different direction. Over the last few months, the Senate sought out the advice of a number of intelligent and influential policy sources as we tried to find a private insurance solution that works for the state of New Hampshire. As with any issue this complex, there are a lot of details and complications, each of which gave some folks something to support and others something to oppose. For example, I want you to bring this home, Mrs. Snow. Tom Scully, a former healthcare advisor to the President, George H. Bush, and a CMS director under George W. Bush, consulted on our plan. Tom, who worked with former Governor Sununu in the first Bush White House, encouraged us to recognize there are in fact free market concepts built into Medicaid reform. Using those concepts, he advocated to move towards private insurance as well as government role in coordinating incentives to improve outcomes and reduce costs and other novel concepts. Eric Roy of the Manhattan Institute and Forbes magazine was introduced to New Hampshire by Conservative Americans for Prosperity. He suggested using subsidies for health savings accounts and a Medicaid demonstration waiver to increase access to care. The right-leaning Heritage Foundation, in a recent policy brief, underscored the importance of the state stepping up to assist those who need it through subsidies in the free market. In their brief, using federal Medicaid dollars to increase access to private insurance market was a key step to reforming the Medicaid program. Using those ideas, as well as the thoughtful comments and suggestions offered by healthcare professionals, medical experts, patient advocates, legislatures, and anyone else looking to get us to say yes on the issue, we constructed a proposal that we believe protected taxpayers and takes the vital steps to increasing our healthcare system. While the governor was busy criticizing and campaigning, the Senate was leading. Earlier today, we came up a little short on our proposal, but because of the work of the last couple of months, we are better prepared for when this issue returns in just a few short weeks. When it does, the Senate will continue to lead, and we sure could use your help. As a party, we must offer viable solutions to difficult issues confronting our state. Healthcare is a key economic driver in New Hampshire. It represents significant expense in our budget. It is an issue constantly on the minds of our residents. Despite having one of the healthiest populations in the country, we pay some of the highest premiums and lack competition in our healthcare market. We can do better. As we look ahead to the start of the session in January, we should recommit in our efforts to lead on this issue and doing better for the people of our state.